Hi, this is Dr. Karen Becker, and today we're going to discuss mast cell tumors. Mast cells are found in all tissues of the body, but are in especially high numbers in the skin, respiratory tract, and GI tract. Mast cells contain histamine and heparin. They play a role in allergic responses, non-allergic skin diseases, wound healing, and tissue remodeling. They can also increase stomach acid production. When normal mast cells replicate in higher than normal numbers, a mast cell tumor can form. Pets with mast cell tumors can have complications like stomach problems from the overproduction of histamine and excessive bleeding from the release of heparin. Mast cell tumors occur in both dogs and cats, and although they can be benign, most mast cell tumors are malignant or cancerous. Mast cell tumors vary widely in their appearance, shape, and size. Dogs usually develop a single tumor. More cats than dogs develop multiple tumors. If your pet has a mast cell tumor on the skin, there'll be a bump or lesion of some kind. Sometimes it's a raised pink bump that looks like a number 2 pencil eraser on the surface of the skin. Sometimes the tumor will be a less defined mass that feels like a lump under the skin. Definitive diagnosis of a mast cell tumor is made through physical examination and testing, including tumor aspiration or biopsy. If the fine needle aspirate reveals mast cells, the surgeon will be much better prepared to take the large margins required, which reduces the likelihood of leaving tumor cells behind, and I think this is really important. The tissue that is removed is sent to the pathologist for staging or grading, which will give your vet the information necessary about how extensive the disease is and what type of treatment is needed then for follow-up care. In cats, mast cell tumors are usually seen in the skin of the head and neck, although they can occur anywhere in the body. Cats with these tumors usually are over 4 years of age, but they can occur at any age, and we've even seen mast cells in kittens. Interestingly, the Siamese cat are at higher risk than other breeds of kitties, and they develop a specific type of mast cell tumor called the histiocytic mast cell tumor. The majority of feline cutaneous or skin mast cell tumors, the goal is to have surgery completely remove the tumor, and usually surgical intervention is curative, which means one round of surgery removes the mast cell, and oftentimes in cats, mast cell cutaneous lesions are benign. In some cases, surgery isn't even needed because the mast cells can resolve on their own. Unfortunately, cats with mast cell tumors on the inside of their bodies, not the outside, so internal mast cell tumors that occur in the GI tract or spleen carry a much poorer prognosis than mast cells occurring on their skin. In dogs, mast cell tumors are most often found on the trunk, limbs, and in between the toes. They occur more often in some breeds, more so than others, so the Boxer, Boston Terriers, English Bulldogs, Bull Terriers, Fox Terriers, Labs, Dachshunds, and Weimaraners are all at increased predisposition. Prognosis for dogs with mast cell tumors depends on the location, the extent of the tumor, the grade, and the type of treatment that was given. Mast cell tumors of the skin are very different in dogs than cats, and so surgery to remove the tumor is less invasive in cats, and the prognosis for a full recovery is much better in cats than in dogs. Mast cell tumors with a generally poor prognosis are those on the muzzle, mast cell tumors that occur around the mouth or in internal organs, mast cell tumors found in the bloodstream, bone marrow, or tumors that are ulcerated also carry a poorer prognosis. If mast cell tumors are causing GI ulceration, or if mast cell tumors are large, fast-growing, or recurring, all of those particular tumor types carry a much poorer prognosis. Historically, mast cell tumors have been graded on a scale of 1 to 3 in dogs, with 3 being the most serious and carrying a poor prognosis. Grade 1 mast cell tumors generally have an excellent curative rate as long as the whole thing was removed, and dogs oftentimes are doing great. 30 weeks post mast cell removal for a grade 1 tumor is considered curative as long as there's no recurrence of tumors within that time frame. Even with aggressive surgery, the occurrence rate for a grade 2 mast cell tumor is about 20%. The majority of dogs with grade 3 very malignant mast cell tumors will experience the spread of the tumor, and only about 10% of these dogs live past a year of surgery. Recently, a 2-tier histologic grading system for canine cutaneous mast cell tumors has been proposed to more accurately predict biologic behavior. And so this particular category system lumps animals into either tumor categorizing into either a low grade or a high grade, carrying a good prognosis for a full recovery for a low grade, or a high grade, which carries a poor prognosis for recovery. In addition to histopathology or looking at the cancerous tissue microscopically, vets now have the option to perform cell proliferation analysis through Michigan State University Diagnostic Lab. I recommend this. This new technology analyzes 3 markers to assess the risk of systemic disease, and vets that use this new technology to help formulate a treatment plan will have a much more accurate blueprint of what's really going on in the mast cell patient's body. If your pet has been diagnosed with a mast cell tumor, work with an integrative or holistic vet to reduce the risk of recurrence. There are supplements that can naturally help reduce mast cell degranulation and reduce histamine release. If your pet has been diagnosed with a mast cell tumor, I recommend you eliminate carbohydrates or pro-inflammatory foods from the diet. I recommend you supplement your pet's diet with a rich source of omega-3 fatty acids, such as krill oil, and I absolutely recommend that you never vaccinate a mast cell patient ever again.